Chapter 3 involves the anatomy of cartilage and bone, which we've already indicated are two specialized kinds of connective tissue. Cartilage and cartilage formation takes place by differentiation from multipotential mesenchymal cells into chondroid precursor cells that give rise to chondroblasts. And chondroblasts generally gives rise to chondrocytes, analogous to fibroblasts in connective tissue, giving rise to fibrocytes. The cartilage mass is surrounded by a perichondrium. The perichondrium is a membrane of connective tissue containing the stem cells, which give rise to both fibroblasts that can produce connective tissue outside the cartilage, and chondroid progenitor cells that can give rise to chondroblasts that obviously form the cartilage. The chondroid progenitor cells can change from small elongated cells to chondroblasts, as we've indicated, which are generally more oval-shaped with more cytoplasm. And those chondroblasts, their major job is to produce and secrete type 2 collagen and some glycosaminoglycans that provide the extracellular chondroid matrix. The immature matrix initially surrounding chondroblasts is relatively eosinophilic or pink staining, as it has proportionally more collagen compared to gags. As the chondroblast matures into a more rounded chondrocyte, it becomes trapped in a lacuna within the matrix. The matrix also matures with proportionally more gags compared to type 2 collagen and makes the cartilage more basophilic or blue staining. So the age of cartilage can basically be determined by pink is younger, blue is older. As a mass of cartilage is formed, it is not penetrated by blood vessels because cartilage is avascular. Cartilage can enlarge in two ways, and we'll distinguish this from bone formation in subsequent slides. Cartilage can enlarge appositionally, where new cells can be added from the outer perichondrium. Generally, appositional growth increases the width of cartilage. In internal or interstitial growth, the chondrocytes that are trapped in the lacunae, embedded deep within the cartilage, can continue to produce additional extracellular matrix in all directions. And interstitial growth of cartilage generally increases the length of the corresponding cartilage. There are three fundamental different types of cartilage. The most widely distributed kind of cartilage is hyaline cartilage. Hyaline cartilage is important because, among other things, it forms a template for endochondral bone formation during embryogenesis, as well as forming the articular cartilage on the surface of all bones and synovial joints. And in addition, it forms the flexible cartilages of the nose, the larynx, the trachea, and the bronchi. Hyaline cartilage is rich in hyaluronic acid, chondroitin sulfate, and keratin sulfate, and has a high water content that resists compression, making hyaline cartilage a very good shock absorber and therefore very useful as on the articular or articulating surfaces of bones and synovial joints. Rheumatoid arthritis can damage articular hyaline cartilage, causing joint pain and ankylosis. And gout results from the deposit of uric acid crystals in joints and is common in individuals using thiazide diuretics associated with hypertension. Picture shows hyaline cartilage, and you can see that the matrix as well as the lacuna are relatively basophilic, meaning the age of the cartilage is older than the young cartilage, which would be more eosinophilic. The arrow basically points to the location of the perichondrium, where we have precursor cells that can either differentiate into chondroid precursors, helping form cartilage, or on the other side at the base of the arrow, forming fibroblasts that will form connective tissue surrounding the cartilage. Next slide shows an illustration of elastic cartilage. Elastic cartilage also consists of type 2 collagen, but has a significant component of elastic fibers. And probably the best known location of elastic cartilage is the cartilage associated with the external ear, forming the pinna. Finally, FibroCartilage consists of both type 1 and type 2 collagen, making it or giving it greater resistance to being stretched. FibroCartilage is found in the intervertebral discs of the vertebral column and in the menisci associated with the knee, and it may form part of the attachment of ligaments and tendons to bone. FibroCartilage is unique associated with cartilage because, unlike the other two, it lacks a perichondrium and has significantly less water in its extracellular matrix compared to hyaline and elastic cartilage.